Alrighty, chat. Let's get started. Welcome to another Healthy Gamer GG stream. Just a reminder that my name is Alok Kanoja. Just a reminder that although I'm a psychiatrist, nothing we discuss on stream today is intended to be taken as medical advice, and everything is for educational and entertainment purposes only. If y'all have a concern or question, please go see a licensed professional. Get yourself some medical advice. So hope y'all are doing well. Couple of things to just keep in mind, couple of announcements before we get started today. Our Touch Grass campaign is now in its second week. Things are super hype. I will probably be uploading my own pictures of the contest. So for those of you that don't know, Touch Grass is a Discord event that we have going on where basically we have a photo challenge. So the goal is to get our community to get out of the house, out of your apartment, out of your four walls, away from screens, and go do all sorts of fun things. The simplest of which is touch grass, but all kinds of stuff like looking up at the night sky, looking up at the day sky, picking a piece of fruit, going for a swim, I think finding an animal, petting something, and all kinds of other stuff. So it's like super awesome to see people in our community are like participating, and you get to upload your pictures of you doing stuff. And it's like, it's super hype. Like, it's just cool. I don't know how else to say it. It's like great. So if y'all want to participate in that, definitely check out the Touch Grass channel on our Discord. I think people are really enjoying it. I think it's one of our most successful Discord events. Yeah, so check it out. So generally speaking, I think for a long time, our Discord was a little bit more disorganized, but recently we've had people like Tech Teller and a group of really fantastic mods who have organized a bunch of really great community events. So we've got a couple of things to also kind of clue y'all into. So today, right when we end stream, we're going to have an Ask a Coach event on motivation. So if y'all are interested in trying to get a sense from one of our coaches, if you have questions about motivation or struggle with motivation or things like that, one of our coaches is going to be on Discord and kind of fielding questions about that. So one of the neat things is that, as Healthy Gamer grew, I realized that a lot of people wanted, kind of a personalized approach to their own challenges. Like basically Dr. K can't get to everyone, right? So we try to do what we can. We've recently shifted to a more call-in format so we can get like 3 or 4 community members per stream and sort of address different kinds of questions. But at some point, I just started to wonder, can I teach people what I know? So can I teach people to help other people the way that I help other people? And especially the way that I help people kind of on stream and I help people in this community, which is actually not like medical care, right? So I can't teach a coach medicine, right? So they have to go to like medical school for that. But that involves things like diagnosis, treatment, pharmacology, stuff like that, this medication versus that medication, polypharmacy, side effects, all that kind of stuff. But that's not really what our coaching program is about. Our coaching program is really about helping people build the life that they want to. And I'm super excited because for the first time in about 18 months or so, we actually have spots open in our coaching program. So this was something that since we started our coaching program 3 years ago, it was, there were some spots at the beginning, but then for a period of about 1.5 years, and some of y'all may know this if you tried to get into coaching, basically it was full. But we actually have spots available now. We're actually training, or the most recent batch of coaches, I think, is also really, really, really strong. So we're sort of having more and more coaches kind of go through our curriculum and things like that. And so I'm really confident in this group. I think it's interesting because, interestingly enough, as we've grown, the number of people who have expressed interest in becoming coaches has gone up. And I think for the last batch of, 10 coaches or something, we reviewed 600 to 1,000 applications. And then we had to close off applications at that point because, we're not going to, get through more than, we just can't review more than 600 applications, 700, 800 applications. So the current batch of coaches in particular, I think, is particularly strong. I think they come from all different walks of life. They share a lot of different, they bring a lot to the table themselves, and they've also been super, super engaged. We've also revamped our curriculum time and time again. Because basically what we do is we're very kind of like outcomes oriented here at Healthy Gamer. So interestingly enough, like my experience with being trained as a psychiatrist or psychotherapist is that even that training was not outcomes oriented, right? So like no one sat down and looked at all of my patients and sort of like compared all of my patients to all of another one of my colleagues' patients and sort of noted that, okay, like, so it seems like Dr. Kanoja is really good at treating like depression and bipolar, but is not great at treating things like anxiety disorders or PTSD. So let's give them kind of focused feedback around that. So that kind of like whole scale patient review doesn't really happen in the medical field. The cool thing is that as you look at like the way that data expands, right? So like now we have instruments and analytics and stuff like that. We basically leverage that for our coaching program. And what we've been able to do is we've made 7 or 8 curriculum adjustments over the last 3 years. So every time when we have a batch of coaches go through it, we sort of figure out, okay, what are these coaches good at? What do we need to improve on? And so like 8 curriculum updates over the course of like 3 years is way faster than what we see in like other educational systems, right? And I think that's the reason that our outcomes are so good. We also recently presented our outcomes at the American Psychiatric Association. And so that was really cool. So we sort of like submitted an abstract and things like that. And it ended up being, people ended up interested in it and what our outcomes were. And so this is a peer support mental health support. It's a peer support service, right, for mental health. And it's really about motivation, goal setting, kind of accomplishing things, understanding who you are. It's really not for the diagnosis and treatment of medical conditions. And so I'm super excited about it. We've finally got spots. People have been on the wait list for like a year and things like that. So if y'all are interested at all, definitely check it out. If y'all are also curious about how coaching works and stuff like that, definitely check out the Ask a Coach event after stream and then potentially get your questions answered there. Key thing also is that if y'all are super interested in this, right now, if you sign up, there's a good chance that you can start within 48 hours. So that's another big thing about our model, which I found very frustrating about the medical model, is that if you try to get a therapist, just the way that the structure works, like, you make a phone call, they call you back, you try to find a time. Sometimes it takes like 10 weeks, 8 weeks, 12 weeks. Even today, and I mean, I don't practice much anymore, but like even like a year ago or 2 years ago when I was really practicing a lot of medicine, one of the key things that I had was that I tended to try to see people quickly, right? So if someone calls me and is a new patient, I try to get them in within a week or two, because my experience as a clinician has been that like, if I think about it, if I've been seeing a patient every week for a year and a new person calls, who do you think needs to see me sooner? Does one patient need their 39th visit this week? Or does the new patient need their first visit this week? Because in medicine, generally speaking, what we tend to do is like if you have an existing patient, like, but what I really sort of found is that I realized that the whole system is like, okay, the person who's been here for 38 weeks gets their spot this week, right? Because they're an existing patient. And then new patients kind of go to the end of the line. Whereas what we really try to do in our coaching program is really try to get people in fast. We also have coaches from several different countries now and across several different time zones. So we recognize it's been really interesting to talk to coaches, for example, from Germany. So I still remember there are a couple of coaches that we have, I think, who are from Germany, maybe Austria, and apologies, because I know it's very offensive to get those two mixed up. But they were sort of telling me that some of like the ways that we talk to clients like don't work in Germany. This sort of like open-ended, friendly, sort of very American approach, like just how culturally ground our coaching program is in sort of like not even Western, but like American approaches to things. And so it's been really great. We have coaches from places like Singapore and Germany and all over the place. And the cool thing about that is that they bring their own South America, they bring their own cultural competency to it. And so the neat thing, I was looking at actually like our current openings, and there's actually like openings 24 hours a day. So that I think is super cool. And so, even if you're let's say you're in North America, but like you have a circadian rhythm problem and like you want to get coached at 2 a.m, like we can handle that. So, Anyway, so if y'all are super interested, or if y'all are interested in all, definitely check it out. We've been working really, really hard to make sure that our current batch of coaches is performing really well, which they do. We try to make this service very accessible. So if y'all want to sign up today, you can get your appointment up to 48 hours from now. So definitely check it out. So, can you get to know the coaches before joining? No. Well, sort of. So that's why we have these Ask a Coach events. So like, that's where like, if you want to understand what coaches are like, but you can't get to know necessarily your particular coach before joining, right? So the whole point is that you get matched with someone and then you get to know them over the course of the coaching process. But if y'all want to get to know coaches in general, like that can happen. Absolutely. That's literally why we have these things like Ask a Coach, right? So you can go talk to a coach, kind of get a sense of like, who are these people? Like, what do they do? Like, you know, I'm kind of confused by this. So definitely check it out. Super MTZZ is that how can I become one of your coaches? You apply the next time we're looking for coaches. We do have Spanish speaking coaches, I believe. When will coaching spots run out? I don't know, but they've been out for 18 months. And probably, I imagine, yeah, I don't know. I don't know how quickly they'll run out. You do not need a camera. So people are asking, do you need a camera for coaching? No, you don't need one. We highly recommend it, but ultimately your safety and comfort is the most important thing. So as Quantum Almonds is saying, Sidekick is the GOAT coach. Good. So I'm glad you had a really positive experience with your GOAT coach. Greatest of all time. Oh yeah, someone's asking, do you have coaches that speak Dutch? Apparently we do. Thanks, Danana. Seiko5 is saying, I had a good experience with Yasha. Very happy to hear that. Yasha is an awesome coach. Sidekick is an awesome coach. And if, for those of y'all that are kind of curious, like, just, I mean, y'all can see these responses in chat, right? So you can see what people are saying. Do coaches speak American? Oh, good. So Sidekick ran a social sandbox today. Happy to hear that it went well. Also, Yasha. So multiple people. Yasha is a effing beast. I love him. Well, props to you, Yasha. Do coaches speak Klingon? Not yet. Gaming Comics is saying, I really enjoyed my coach. We had a very positive experience. Happy to hear it. Any Russian-speaking coaches? I don't know, actually. Uterok is asking, are coach conversations privileged info by law? Generally speaking, no. So this is something that every coach will explain to you. So your confidentiality is absolutely very important to us, and we don't advertise names or things like that. Your coach won't be discussing your business with other people. But if subpoenaed by a court of law, the coaching relationship is not a protected relationship like an attorney-client privilege. Jonathan's 1212, you should tune into one of the social sandbox events if you ever have free time. I will. You have convinced me, Jonathan's 1212. Do you have stats on outcomes with coaching so far? Absolutely. So I think this is like all over our coaching page. But this is what we presented at the APA. So we presented our initial outcome study, which is very good. So a couple of things about our outcomes is that we do measure certain mental health outcomes. Like, so we measure, we use validated instruments to measure depression and anxiety. So these are the same treatment. These are the same scales that are used to measure treatment, but you can use them to measure things besides treatment, right? So it's just measures of depression and anxiety. But the key thing about our coaching program is that we measure a lot of other stuff too. So we'll measure things like a sense of purpose in life. We'll measure feelings of agency. So when people come into our program versus when they leave, they have roughly a 25 to 33% improvement in their sense of control in their life. So when they come in, they feel like, they're maybe in control of a quarter of their life. And by the time they leave, they feel like they're in control of like half of their life. Feelings of purpose also increase about, I want to say about 33%. And then we'll see improvements in depression and anxiety from about 25 to 40%. There's also a lot of like details on that data. So part of the reason this gets complicated, but there are a lot of reasons why those numbers are very conservative. So for example, like I'll just go into like, so this, you guys are going to get me talking about research. So I'm going to talk about this for like 5 minutes because it's interesting to me. So let's talk about this. This is neat. Coaching outcomes. I love this stuff. So if I take 100 people from my community and I give them an anxiety scale, what percentage of the community do you think will qualify for having a certain amount of anxiety? Let's say like they have moderate anxiety, right? So if you look at our population, let's say a third of people will have no anxiety. Let's say a third of people will have mild to moderate anxiety. And a third of people will have, let's say, moderate to severe anxiety. Those numbers are probably not very accurate, but let's just assume that for a second. So now let's say I give all of those people some kind of intervention. Doesn't matter whether it's coaching, medication, whatever. And then when I measure improvement, I detect a 33% improvement. Now, the key thing here is that a third of the population didn't have anxiety to begin with. So what improvement are they seeing? They're seeing no improvement because it wasn't a problem to begin with. So when I actually see a 33% improvement in my population, that is accounting for the fact that a third of the population didn't get better at all. So the actual improvement that you see if you have anxiety is actually greater than what the statistics will show. Does that make sense? So due to scientific rigor, we're not allowed to discount, or at least in our initial outcomes. That doesn't make sense? So this is the interesting thing about coaching outcomes is right now we measure sort of everything for everyone. But what that sort of means is that the effect of our program is being diluted. Because, for example, if we're looking at depression and anxiety, let's say half of the people coming into the program have depression, half of them have anxiety. We actually improve both of those things. But if we improve both of those things, the effect size is actually going to be smaller. Right? So that's the interesting thing. Now, then this begs the question, but Dr. K, you're saying that this isn't medical treatment. How can it improve depression and anxiety? There are all kinds of things that are not medical treatment that improve depression and anxiety. Mindfulness at the top of the list. Right? So as a society, the other thing that I think has happened is we've stopped appreciating that there are non-medical interventions that can improve your mental health. So we understand this in a physical sense. We know that stretching, yoga, tai chi, exercise, swimming, diet, all of these things can improve cardiovascular outcomes, endocrine outcomes, diabetes, obesity, right? Even neurological health. So we know that, for example, exercise and yoga and mindfulness and all that good stuff reduces your risk of stroke. If it reduces your risk of stroke, doesn't that make it medicine? No, not at all. So this is actually what I think is missing in our society is that we have a bunch of stuff for physical health. We've got a group of personal trainers at the gym. We have gyms all over the place. We recognize that focusing on your physical body, devoting a couple hours a week to improving your physical body will overall improve your health and like move you in the right direction in life. The problem is that we don't have that for the mind. And that's literally why we made a coaching service. And it wasn't, so I had a choice, right? I could have done like therapy with people and I could have trained a bunch of therapists. I could have gone to a bunch of therapists and I could have said, hey, let me teach you everything that I know about technology and digital mental health problems and stuff like that. And people have asked me to do that. And I teach, right? So I teach at Harvard Medical School and places like that. So I teach. But what I really noticed was that, like, let's say I teach 100 therapists what I know about technology addiction. How does that actually impact our community. So this group of people that I signed up on Twitch to help, how does that affect y'all? Right? So now you call someone, like let's say I say, okay, oh yeah, there's this person. I've trained this person. They know what I know about technology addiction. Then you call them and you're like, cool. Like you call and you're like, hey, my name is Alex. I'm from the Netherlands. I'd really like your help. And the person is like, I'm in Oklahoma. Do you have insurance? And the person in the Netherlands is like, I don't know. We have socialized medicine here. And the person is like, okay, fine. I'm sure we can figure something out. My first appointment is in 10 weeks. Right? This is the problem, is like giving additional training to clinicians is an important part of fixing mental health in this country. The basic issue, though, is it's not like clinicians are sitting there with 40 hours of open time on their schedule. So why do we need coaching? Why is the World Health Organization, the United Nations, and the U.S. Office of the Surgeon General calling for peer support mental health services? It's because they recognize that the problem is not that our clinicians are insufficiently trained. The primary problem is that we can train clinicians as much as you want to, but like, how are y'all actually going to see them? That's the challenge. And so then the question becomes, can you actually take members from our community, put them through an educational curriculum, and can they effectively help people from our community? And at this point, I'm confident to say that the answer is yes. Anyway, so enough about that. We have actual stuff to talk about. Okay. But the research stuff is fascinating. Okay. Let's take a look at, leaked chat. What do you think about docs that focus more on exercise as opposed to drugs to treat severe anxiety? Okay, we're going to talk about panic attacks. I guess we'll start with this one. So let's understand this. So doctors can have particular foci, right? Like I, for example, focus on evidence-based complementary and alternative medicine in my psychiatric practice. But at the end of the day, the focus should not be determined by the doctor. The focus should be determined by the patient. The issue is, what does the patient need? That's what should guide us, not what the doctor's specialization is. In fact, if you focus on the doctor's specialization, I've done this in my practice, where sometimes people will come to me because they're sort of interested in a holistic perspective on anxiety. And then they'll be like, try as I might to get them to meditate, they just really don't like meditation. They don't want meditation. They just want psychotherapy plus medication. And so I've had those patients, and that's where it's like the focus is determined by them, right? So I try it a couple of times. Then one day, like after like a month or 5 weeks or something, I'm like, hey, so it seems like you're really struggling with meditation. Like, what's going on? And then we had a frank conversation about it. I was just like, bro, just tell me straight up. Do you want to learn how to meditate? And he's like, honestly, not really. And I'm like, totally fine. Right now that that's out of the way, like we can stop wasting our time on it. And so the focus should really be determined by the patient, not by the doctor. Okay. Dota stream maybe? Absolutely one day. But we've got important things to discuss. Okay. So what we're going to do is talk a little bit about, since we're talking about anxiety, we're going to talk a little bit about panic attacks. So if y'all have seen Dr. K's Guide to Anxiety, you know that we have a video on panic attacks. But generally speaking, we talk a lot more about anxiety than panic attacks. So what I'd love to do today is to talk to y'all a little bit about panic attacks and a couple of key things about panic attacks, okay? So has anyone else been mostly fine their whole life, then randomly got a panic attack as an adult and haven't been the same since? Just wondering. I'm 25 and I used to be able to live a perfectly normal life. Then I had what I believe was my first panic attack 2 months ago. The first month was so hard, I didn't want to leave the house at all. I struggled to even get out of bed. This month, I'm getting better and slowly getting back to normal. My anxiety symptoms persist, muscle weakness, heavy arms and legs randomly, and I get blood rushing to my head for no apparent reason. I'm not even sure if it is anxiety, but it's been 2 months and I'm still alive. I'm having trouble believing my symptoms are just anxiety. I also find it hard to believe anxiety and panic like this could onset at my age. So this is a really important post because, and the reason we're talking about panic attacks is because there's a lot of stuff that people don't understand about panic attacks. The first is that we assume that panic attacks and anxiety are related, right? So there's sort of this idea that like, okay, if I have panic attacks, I should go see a psychiatrist. It's a mental health issue. If it's a mental health issue, that must mean that it involves my mind. And this is what confuses a lot of people who have panic attacks because they assume that the origin of the panic attack is mental in nature. And then as you start, the more perplexing thing is that sometimes, like, you know, you'll see something like this where people are like, I'm not even sure if it's anxiety because I'm not even anxious particularly. Like, I don't have any particular fears. It's like a random, like, I'm living a perfectly normal life and then suddenly I had a panic attack. And then I have all this weird crap going on with my physical body. And like, it just doesn't feel mental. It doesn't feel like anxiety. And so what I'd love to do today is talk to y'all a little bit about how that is absolutely what a panic attack and panic disorder is like. So the first thing to understand is that panic attacks are a symptom. They're not a diagnosis. So it's kind of like fever, right? So this is another example of a symptom. So what causes fever? Well, COVID could cause fever, cancer could cause fever, you know, strep infection could cause fever, pneumonia could cause fever, staph infection in the skin could cause fever, all kinds of things can cause fever. It's a symptom. Now, the most common source of panic attacks is a diagnosis called panic disorder. Now, a diagnosis is like an etiology, so it's like a source of a problem. So if we take a diagnosis like COVID infection, this is going to create fever, it's going to create shortness of breath, it's going to create maybe changes on your x-ray, it's going to create, runny nose. So it's like a constellation of symptoms that all are caused by one thing. Now, the interesting thing is that pneumonia can also cause all of these changes, right? And you can have a COVID-related pneumonia. So that gets a little bit more complicated. But do you all sort of get how, let me move this. Do you all sort of get how there's a difference between a symptom and a diagnosis? And there are a couple of key features to the diagnosis of panic disorder, which a lot of people don't really realize, but is actually quite elucidating. So when someone has a panic attack, what is the primary experience of the panic attack? So the first thing to understand about the primary experience of the panic attack is that it's predominantly physiologic. So people oftentimes have elevated heart rate, so their heart is beating super fast. They'll have difficulty breathing, so they'll get shortness of breath. They'll have nausea. They'll get sweaty. They'll get muscle tension or shakes. Right? So it's a very physical thing. It feels like something is wrong with you physically. And what this actually does is this results in a sense of impending doom. So when someone has a panic attack, instead of asking them, what are your deep, dark fears? Instead of approaching it psychologically, oftentimes what I'll ask them is like, did it feel like you were straight up gonna die? Did you feel like you were gonna die and like the world was like ending? And then they'll oftentimes, if they have a real panic attack, they'll say yes. Whereas if it's more like, anxiety related, oddly enough, that may not actually be a panic attack. So this is the first thing to understand. If you've got a panic attack, is it's very physiologic in nature, okay? So now that we know that, what we're gonna do is talk a little bit about panic disorder. And then what we're gonna do is look at some of the mechanisms through which this happens. And then we're gonna tell y'all what to do about it, okay? So The interesting thing about panic disorder is that in order to be diagnosed with panic disorder, you need one really important feature, and that is adjusting your behavior or a persistent fear of future panic attacks. So this is really important to understand. Oftentimes, what causes us problems in life, what really impairs our function, is not the original issue. It's the way that we adapt to the issue. And what we see in panic disorder is not just the panic attack. What really cripples people in panic disorder is not actually the panic attack. It's the fear of the future panic attack. So a good example of this is something that people call agoraphobia. What is agoraphobia? It's fear of leaving the house, fear of going outside. This is truly what's debilitating about panic disorder. It's not the panic attack itself. It's the fact that what will happen if I have a panic attack at work? What will happen if I have a panic attack at the movies? So what people end up doing is they stop going to the movies. They stop going to work. Right? You don't even have to be necessarily agoraphobic, like even if you're okay with like going to the grocery store and leaving the house and you enjoy going for walks. But what I tend to find in people with panic disorder is that they come up with like contingency plans for if they have a panic attack. So it's like, okay, I'm willing to go to a restaurant, but like only a restaurant that has 3 stalls in the bathroom. And I'll be like, why do you need to go to a restaurant that has 3 stalls in the bathroom? They're like, well, I recognize that oftentimes one stall may be occupied. And in some cases, like, you know, if one stall is occupied and someone else goes in, the second stall will be occupied. But I absolutely need access to a bathroom stall if I have a panic attack because I need to hunker down for like 20 minutes there. So the only restaurants I'll go to are the ones that have 3 stalls. Or I need some kind of safe escape. This is really common for people with panic disorder. They need to know how to get out of a situation if they have a panic attack. Okay? So the key thing here is that if we look at like a lot of what causes us problems, it's not the original insult, it's the consequences of the insult or the adaptation. We also see this, for example, in like the dating world, right? So if I have a bad experience with a particular person, I can generalize things about that person. So I can generalize things about their gender. Oh, this gender can't be trusted. This gender is cruel. I can generalize things about their race or their ethnicity. I'll never date this race or ethnic of a person again, or this kind of ethnicity again, because all of the people of that race or ethnicity are like this. It's not just the original problem in the date, it's the adaptation that we make to our negative experience, which actually causes us problems. So a key feature of panic disorder is actually adjusting your behavior or a persistent fear of future panic attacks. Okay? Now what we're going to do is talk a little bit about the mechanisms of panic attacks. And this will also set us up for what you can do about panic attacks. So, the first thing to understand is that we tend to get signals. So these are things like heart rate, blood pressure, sweatiness, nausea, shortness of breath, things like this. We get these physiologic signals. And then our brain is trying to interpret these signals. Because it's like, if I'm 25 years old and I'm healthy, and every organ in my body starts like getting messed up. Like my heart is pounding in my chest. I can't breathe. I feel like vomiting. I'm shaking. It's like, what on earth is going on? Then what happens is there's an interpretation. And then there's a conclusion. I'm dying. And then what there is based on that traumatic experience, there's an adaptation. Does that make sense? Now, if we look at things like therapy, like psychotherapy really works here and potentially here. But it doesn't actually work here, oftentimes, okay? So let's try to understand a little bit about what we know about this right here and what we can do about that. So there are a couple of really interesting things. The first is that we know that there's an interesting hypothesis that we have a suffocation reflex. So when we start to suffocate, so if someone's like choking me or like I'm drowning or something like that, there's a reflex, a very strong survival mechanism that activates, and we have this kind of suffocation reflex. So the suffocation reflex is going to activate, cause all kinds of changes to our amygdala, also cause physiologic changes like adrenaline rush. And then this in turn will lead to things like heart rate, increased respiratory rate, right? Shortness of breath, all that kind of stuff. Now, the interesting thing about the amygdala, so this is our fear center of the brain, is that the amygdala also has an apneic response. So apnea is the cessation of breathing. So when we're very, very scared, right? I don't know if y'all have ever seen like videos of like animals on the hunt or whatever. When we're terrified, what happens to our breathing? We freeze. So what activation of the amygdala can do is actually alter our respiratory rate and actually make us stop breathing, which in turn will increase our CO2 and will cause a hyperventilation consistent with a panic attack. So what's going on in a panic attack? I suspect, so there's data to support this, but we don't really know 100%, that a panic attack is actually physiologic in origin. And what you actually get is an inappropriate activation of your suffocation reflex. So sometimes something happens and like this reflex, this survival reflex turns on without it supposed to be turned on. And so then we get this adrenaline rush that explains all these symptoms. We also get activation of the amygdala, which gives us a sense of fear, right? Which then turns into these thoughts like I'm dying. And then also triggers this whole cascade, which affects our respiratory rate, which in turn ends up affecting this. And by the way, this all the way goes back over here, and then we get our panic attack. Does that make sense? So the key thing to understand if you've got panic attacks is like oftentimes people think in panic attacks think I'm dying or something's fundamentally wrong with me. And arguably, I mean, obviously if you're having a panic attack, there is something going on that's not supposed to be going on. But instead of having cancer or impending doom or things like that, chances are it's actually just a misactivation of certain parts of your brain. That's the theory that I think has the best support behind it and also is consistent with what people actually experience. Okay? So in a sense, like you'll be okay, but there's also treatment for this. Okay? So what should you do if you have a panic attack? What do? The first thing is that if you're actually having a panic attack, and if it's your first panic attack, I think it's completely appropriate to seek emergency medical services. This is completely appropriate. So in the US, you can actually call 911, you can go to the emergency room. This is important to understand. So a panic attack, generally speaking, is not going to kill you. But emergency medical services are not just for things that are going to kill you. Emergency medical services are for things that we don't know if this is going to kill us or not. Does that make sense? Like, it's not your job as someone who's experiencing a panic attack to be able to differentiate between a cardiac arrhythmia, which could absolutely be lethal, and a panic attack. So I'm not trying to, stress y'all out here. What I'm saying is that if this is your first panic attack and you really don't know what's going on, or if you have another one and you've never gotten diagnosed or something like that, you should absolutely seek emergency medical services. Because the important thing here, and we'll get to this in a second, and let's say the panic attack has passed and you didn't seek emergency services. What should you do the next day, the next couple days, things like that? You should absolutely seek a medical evaluation. And why do I say a medical evaluation instead of a psychiatric evaluation? So this is one of the things that I think is unfortunate about the way that we train therapists, is you may say, okay, I'm having a panic attack, I need to go see a therapist. The problem is that there are all kinds of things that can cause these symptoms. And while a panic attack may be the most likely, there could be things like cardiac arrhythmias. So a cardiac arrhythmia is irregular activity of the heart, irregular electrical activity of the heart. And these can be transient. So you can get a heart that's like starts beating very, very fast when it's not supposed to, and when it beats not properly. So it's kind of like, the way that our heart beats. So our heart is kind of shaped like this, and it's filled with blood. And then what it starts doing is actually like it contracts from the bottom. And then it contracts higher, and then it contracts higher. So that if you think about it, if I'm squeezing something from the bottom and the opening is at the top, what I'm actually going to do is facilitate the flow out. But if I start squeezing from the top, that's not going to help things, blood leave the heart. It's actually going to push it downward. And then I start squeezing from the bottom, and then like the heart doesn't empty appropriately. So arrhythmias can cause all kinds of weird things like this. There are also issues, for example, with thyroid. So if you're hyperthyroid, you can sort of get symptoms of a panic attack pretty easily sometimes. So the key reason for medical evaluation is that there may be medical causes to your quote unquote panic attack. That's why you need to go see a medical professional. And unfortunately, I have seen cases where people will go to therapists. The therapist, if you're like a licensed clinical social worker, like you don't regularly order lab tests for your patients, right? Like you're not taught how to interpret lab tests. So hopefully what happens is a good therapist will say, by the way, have you gotten a medical evaluation? Why don't you talk to your primary care physician or GP? And then like we can work on the panic stuff, but let's just make sure that it's not medical in origin. So a good therapist will do that. But you should get a medical evaluation, because the key thing here is I've had some patients with panic attacks who will like find a medical cause. And once we find a medical cause, they'll like fix the medical cause. So they'll start medication or maybe even have a procedure or something like that. And then their panic attacks are like literally cured, like done. Never a panic attack for the rest of your life. You're fixed. So that's what's really important about getting medical evaluations, even if you have something like a panic attack. Now, a couple of other things to consider. So let's talk about psychotherapy. So this is where I think psychotherapy and medication are equally effective, generally speaking. So if you look at effect sizes that compare the improvement from psychotherapy and medication, they tend to be about the same. So one isn't better than the other. But if we look at how psychotherapy works, I personally find psychotherapy to be very effective, especially at this adaptation step. So it's not just the panic attack itself, it's the way that I have to account for the panic attack, that the way I adapt to it, the way that I maladapt to my panic attacks, the way that my panic attacks start controlling my life because I'm afraid of the panic attack. That is where psychotherapy can really, really do a lot of good work, because it can help you reclaim your life. It can help you notice what these adaptations are. It can help you conquer some of those maladaptations and hopefully start to live a pretty healthy life. The other interesting thing is that psychotherapy, depending on what kind of psychotherapy you can do, you can stop this cognitive process of interpretation. So when I feel these signals, my mind interprets those signals and makes me conclude that I'm dying. And then this conclusion that I'm dying is going to create all kinds of other effects. So stopping that interpretation can be very, very useful. Sort of understanding and coming to appreciate, oh, this is just a panic attack. It's my suffocation reflex inappropriately activating. It's amygdala hyperreactivity. I actually don't have too much to worry about. And interestingly enough, I know it sounds kind of weird. Can you just tell yourself that? And that's where the therapy sort of helps you train skills to avoid cognitive mistakes. And it can help, absolutely. So there are medications for panic disorder. This is where a lot of people think and hope and unfortunately still prescribe things like benzodiazepines. And benzodiazepines can be effective for treating an individual panic attack. So things like Xanax or alprazolam or Klonopin or clonazepam. These are the benzodiazepine class of medications. They basically work on the same receptors as alcohol, can be highly addictive and habit forming. These are not actually the best first-line treatment. The best first-line treatment is actually SSRIs or SNRIs. These are selective serotonin reuptake inhibitors, serotonin norepinephrine reuptake inhibitors. So these are medications that are also in the antidepressant class. And they seem to be pretty effective. Now, the interesting thing is a lot of people talk about breathing. So let's talk about breathing for a second. So I'm a big fan of breathing. I teach a lot of pranayama. I'm all into like, oh, I'm Dr. K and I love like my meditation and like, oh, like let's learn how to meditate. Meditation is effective at reducing symptoms of panic disorder, by the way. The problem is that if you look at studies, if you look at meta-analyses of studies for breath training for panic disorder or panic attacks, it turns out that the evidence is average. It's not up, it's not down, it's kind of in the middle. So breathing, a lot of people may think that, so I personally have certain interpretations of the literature, but if you look at it on the whole, breath training does not seem to be a consistently effective intervention for panic attacks, which oftentimes is very confusing for people because when they have panic attacks, which the vision that you have is someone breathing into a paper bag, right? So I personally still use breathing techniques for people who have panic disorder and panic attacks. I personally think that the problem with the research is that they'll call things breathing technique or breath training. But if you've studied things like pranayama or qigong or real yogic meditation breath techniques, you'll realize that they're wildly different, right? So not all breath techniques are appropriate for panic attacks. The problem is that there's no uniformity in terms of what they call breath training. So it's basically, if you do something with the breath, does it help panic attacks? And the answer is, generally speaking, we can't conclude that the answer is yes. So it doesn't mean no, it just means that there's variable responses. And I suspect that's because of the way that you do breath training really matters. There's good breath training and there's bad breath training. The problem is that the people who are doing the breath training aren't experts in like yogic science and don't understand, like they're just like, oh, like it's a meditation technique and like, oh, like let's just use it. And it turns out that I don't think that that's very effective. So I personally will still teach this stuff and I see good clinical effect sizes, but if you look at the whole of the literature, it turns out that breath training is like a plus minus kind of intervention. It doesn't seem to be as consistently effective as psychotherapy or medication. And part of the advantages of something like medication is that it's standardized, right? Like it's standardized, whereas things like breath training are not. So mindfulness or meditation does help, so you can definitely do that. But this is where, I hate to break it to you, but if you're having a true panic attack or you have true panic disorder, sometimes, like later on, we're going to talk about, things that will offer answers in a different kind of way. So this isn't medical advice, but this is just to explain that based on if someone were to ask me a general question, if I have a panic attack, what should I do? I'd say go see your doctor. And that may be like a little bit of a disappointing answer, but sometimes that's actually the right answer, right? Like I think talking about cognitive patterns and talking about this meditation and that meditation, it can help you in this way and that way. And that's like all good. Like I'm not saying that there aren't additional things that you can do. But part of what I learned in medical school is that some of this like new agey kind of even like meditation and stuff, which I'm a huge fan of, like sometimes it just doesn't work as consistently as some of this other like Western medical stuff. And we could talk about yoga and samskars in the mind and focusing and all this kind of good stuff. But sometimes what you really need to do is like go to the emergency room. Sometimes what you really need to do is like go talk to a doctor and get your thyroid checked. And if you're honestly asking me, like if I had a family member who had a panic attack, what would I do? If they were having a panic attack, I would send them to the emergency room. If they told me, hey, I had a panic attack yesterday, what would I do? I would say, hey, you should go see a doctor and like get yourself like physically checked out. And then after that, you know, we can explore some of these things like psychotherapy and medication. And then if you want to, you can try breathing techniques and you can try meditation and mindfulness. But it's really important to understand that these things should not be a substitute for these things. Now, if you don't want to put medications in your body, that's totally fine. Then by all means, go do psychotherapy. Questions? Yeah, so Aaron Robin is saying deep breathing didn't really work for me. It just made me more nauseous. You know, it's really unfortunate, but like that is sometimes people's experience, right? Is it possible to frequently experience signals but never had a panic attack? Very possible. I mean, all kinds of stuff is possible. That's where, you know, and that's where the mechanism is kind of important, right? We don't know if it's like the suffocation reflex or there's some amount of amygdala hyperreactivity. So if someone is already using SSRIs, do they have a lesser chance of a panic attack? I would guess that the answer to that question is yes. Can a panic attack make you feel like you're having a heart attack, like big chest pain? Absolutely. So isn't bellows breath of fire completely shallow? I've had great success with it. Yeah, so this is where there's a lot of nuance to the technique that we use. So let's talk about bellows breath or breath of fire. So for those of y'all that don't know these techniques, they're in Dr. K's guide. You may be able to find them on YouTube as well, because I think we've taught both of those on stream before. So the key thing about bellows breath and breath of fire is that what you're actually doing is hyperventilating to become hypocapnic. So when you increase your respiratory rate, you drop your CO2 level. And when your CO2 level drops really, really low, what that forces your body to do, or not force, but what it sends your signals to your body to do is actually breathe slowly. So then it's like, wait a second, our CO2 level is too low. Let's slow down our respiratory rate to get our CO2 level back up. And as you have that physiologic suppression of the respiratory drive and your rate of breathing goes down, you're taking like 2 breaths a minute, 3 breaths a minute, that is incredibly relaxing. Someone else is asking, so you're saying that the literature lacks technical specificity with pranayama? 100%. That's a great way to put it. So we're starting to see this, where now people are doing studies on something called cardiac coherence breathing. Cardiac coherence breathing is nadi shuddhi pranayama. They just call it a different thing, right? And then they say, oh, cardiac coherence breathing is effective at all these kinds of things. But then people will continue to say, oh, pranayama is like alternative medicine, right? And so I hope that we can sort of continue to move things in that direction where we test these different kinds of pranayama and start to see differentiating physiologic effects and treatment benefits. So how do you help a friend who's having a panic attack in the moment? You get them to emergency medical services and make sure that it's not something more serious. What do I do if I'm at the point, if I have agoraphobia already? Great question. That's why you need to see a therapist, right? So the process of overcoming that agoraphobia is absolutely something that a therapist can help you with. So Shadow7578 is asking if I feel like my heart is actually skipping a beat and my breath gets heavy, but in 15 seconds I'm fine. Is that a panic attack? So that's the kind of thing where like that you need a medical evaluation for that, right? So here I am educating y'all about the specifics of panic attacks. But this is important to understand. If you have a particular constellation of stuff, I don't know what that is, because in order to confidently answer that, I would actually need to do a medical evaluation on you, right? I would need to ask you a bunch of questions, like how often does it happen? What happens? What happens to your heart rate? Let's check your, like in order to answer that question, I would check your thyroid. I would also potentially send you for, general practitioner evaluation, maybe get something like an EKG. I don't think EKG is super appropriate in that situation. My point is that the more specific your question is, hey, Dr. K, I have this constellation of weird things. What is it? That's exactly why you should go see a medical doctor. Because the information that you're giving me may not be the relevant information in figuring out what it is. That's why doctors ask a bunch of questions. So Marmalade is asking, would you agree that expiration is what makes breathing relaxing? I personally only feel better when I focus on breathing out instead of in. So it's partially true. The key thing is that the length of exhalation, generally speaking, correlates with the degree of relaxation. So it's not just exhalation. Chances are, since you're focusing on exhalation, what you're really doing is slowing down your exhalation. Because when you focus on your breathing, you tend to slow it down. And as you slow it down, chances are you start to feel more relaxed. Do I have a paper on cardiac coherence breathing? I mean, you can just search for it, but cardiac coherence... It's not about... So people will do studies like on particular conditions, right? Does that make sense? So there may be papers on just straight cardiac coherence breathing, but usually what people are doing is it's like cardiac coherence breathing for PTSD, if that makes sense. But I don't have a particular study on hand. Is there a difference between an anxiety attack and a panic attack? Or are they synonymous? Anxiety attack is not a medical term. Panic attack is a medical term. So I generally think of them in the common, like, usage is synonymous. When someone says, and that's why, like, when someone says, I had an anxiety attack, that's where I will assess them, right? So I'll do a clinical assessment. I'll ask them, what did you feel? When did it start? How long did it last? How do you feel now? Has it happened before? And then I'll determine whether something called an anxiety attack was a true panic attack or not. Okay. Yeah, so Maluka is saying, 3 years ago I had a series of panic attacks and I didn't know what they were. Now I'm kind of in fear of having another one. I think I should see a therapist for that. I think you should too. Seiko5 is saying, I've only reached a no mind state once. Now I'm trying to reach it a second time. It's way harder. Any tips? Yeah. So the funny thing about meditation is the first no mind state you reach is easier than the second. The second is actually the hardest. The reason that the second no mind state is harder than the first no mind state is now you have an expectation of the no mind state. And so since you're looking for the no mind state, your mind remains active because it's wanting a no mind state. Right? Does that make sense? It's like you stumble upon something, and so the reason it's easy to stumble on it the first time is because you have no expectation of it. Now that you have an expectation, that expectation exists within the mind and is like harder to let go. So what you have to do is stop looking for the no mind state in meditation, and then you'll find it again. So Giblin's asking, have you seen How to Change Your Mind on Netflix, and you have thoughts on it? We're thinking about doing a stream about that on Monday. I'm going to try to watch it over the weekend. Okay, let's move on. We've got a couple other things that we want to cover. Okay. I feel like I'm destined. Actually, hold on a second. Let me make sure. Which one do y'all want to do next? Do you guys want to talk about feeling destined for mediocrity? Or, all right, let's just do it. Okay. All right. So let's take a look at this one, okay? I feel like I'm destined for mediocrity. This post is probably going to come off a little bit desperate/pathetic, but I needed a space to type it out and be heard. As the title says, I feel like I'm destined to live a mediocre life. I'm a more creative mind person, and I get bored very easily doing monotonous tasks that don't allow me to express myself in any way. Issue is, in the real world, only the best get to make their dreams/passions a lucrative reality. And I've tried for so long to become the best, but I'm starting to think that my best will just never be good enough. Everyone around me always seems to think that I'm destined for some great thing, as if they're seeing something about me that I'm not. But they're not nearly as knowledgeable about my craft as I am, so they can't see that I'm not cut out for it. I'm better than the average person, but being better than average doesn't mean you'll get noticed or be able to make a job out of your passions. I feel like I need to learn to be content with a life of misery in the rat race, as many others have. It feels like the only option I have. What do you all think? I know this probably didn't make much sense, but any words would be appreciated. So this is something that a lot of people struggle with. And what happens is you grow up, or you're growing up, and you recognize that you're different from the average path of success. So you look around and you look at the people who have like stable jobs and are happy and are quote unquote successful, whatever. And what you tend to find is like these people are like, they're pretty like monotonous, right? So it's like, oh, this person was successful because like every day after school, they went home and they studied and they did their extracurriculars on Thursday nights, and on Saturday mornings, they did volunteering. And then they joined the swimming team, and then they got into a good college and they studied every day after school, and they did college swimming, and then they got into a good grad school, or they got hired as an engineer here. They picked some like boring, monotonous major that has a good starting salary and job security, and then they became successful. And so you kind of look at this and you're like, well, like, if I was living that person's life, I would go insane. Like, I couldn't do it. I couldn't go into the office every single day and like do the same crap, you know, whatever that job is, or this job or whatever. Like, I just get way too bored with that. I'm a creative person. And then like the problem is that like you look at this sort of successful path in life and you kind of say, okay, this doesn't really work for me. And then you recognize that it does work for some people, right? So like some people will have like you visited an art gallery and there's like a painting there that someone is selling for like $200,000. And you're like, wow, like, so apparently it's possible. But how many people make art, and how many people sell a painting for 200 grand? How many people have their art featured in a gallery? So you kind of realize that there are two paths, right? You can be the monotonous path where you can become relatively successful because like they want to pee on, or you can go to the creative path where like 99% of people are starving artists, right? And even if you think about it societally, we don't talk about the starving software engineer. I mean, maybe I'm sure they exist, but the idea is the starving artist, right? And then you recognize that even if you can be successful, but like the chances of success given your talents and strengths is really low. And so then what happens is you sort of end up kind of like resigning yourself to a life of misery. You're like, I guess the only way for me to like be content in life is to accept misery. That's my strategy. Right? Because like you're not in the top 1%. I mean, even this person is saying, I'm better than average, but I ain't in the top 1%. And so the only conclusion that you kind of come to is like, well, it seems like I'm destined for mediocrity. So what I'm going to do is learn to be content with a life of misery, be a part of the rat race. And since it's not my passion, I'm going to be destined for mediocrity. Because how can I ever be the 1%? If I can't even be the 1% in what I'm good at and what I'm passionate about, how on earth am I ever going to be the 1% at this engineering firm? So how do you navigate this? It's super hard. So let's understand a couple of things first. So if we look at this post, what we see is that this person starts with ideas. Okay? So let's just take a quick look at what some of these ideas are. Okay, so I get bored easily with monotonous tasks. Issue is, in the real world, only the best get to make their dreams/passions a lucrative reality. Right? So this is kind of like a key idea. So there's like the monotonous people. They can be successful. I'm not monotonous. And only the best make passion a reality. So we start with these ideas. And then what happens is we become miserable. Right? Because if all these things are true, and we believe them to be true, we're not idiots. We believe these things for a reason. We go to art galleries and we see, 1 out of 1,000 artists actually selling paintings. As we become miserable, we then conclude that my only choice, I feel like I need to learn to be content with a life of misery. It feels like the only option I have is to become content. So where is this person's focus? What are they going to learn? Where are they going to invest their energy? They're going to invest their energy over here. So they're going to learn how to meditate. They're going to learn how to journal. They're going to try to learn detachment. They're going to do all this really important internal work to be content with a life of misery. Forget the oxymoron there in a second, because if you're content, then you're not miserable, but whatever. So this is doomed to failure. But this is where they focus on. And what do you think this actually does to this part? Nothing. So the first thing to understand is that when you adopt this mentality, not only is it true, you're making it true. It becomes a self-fulfilling prophecy because you invest your energy here instead of changing this. Because this person doesn't have an option to build a life that is less miserable. Like literally, they say it feels like the only option I have is to be content with misery. We'll get into why that is in a second. But then there are a couple of other interesting things to understand. So when I'm miserable about my life, enter this. This is an interesting thing, right? Everyone around me seems to think I'm destined for great things. But they're clueless. Right? It's like when your mom is like, "Oh, beta, you are so handsome. Any woman would be lucky to marry you. You're so good child. You're the bestest. You're the smartest. You're so handsome. Oh." And so everyone around you offers you reassurance. right? They say all these kinds of things. Oh, it's okay. You're so talented. You're a genius. Oh, beta, you're a genius. And how does that make us feel? When you're like 25 years old and you're alone and you haven't been on a date in 2 years, and your mom is sitting there telling you that you're the most handsome, most wonderful man in the world. Or you're a woman and your dad is telling you that, or you're a woman and your mom is telling you that, whatever. Right? It makes you feel worse. It actually increases your misery. As it increases your misery, you double down on this. And so you kind of like doom yourself to trying to become content with misery as opposed to fixing the misery. And when you stop trying to actually improve your life, that's when it really becomes true. And then a year goes by, right? So a year goes by and then like you're more miserable. Misery leveled up. And then you're like, man, I got to learn me some coping skills. Be content. Meditate harder. I'm not meditating good enough. And the cycle repeats itself. Okay? So let's understand a couple of interesting things here. So why does this happen? Why do we resign ourselves to being content? Like, it's kind of weird, right? Because what we actually need to do is be, like, if we want to solve this problem, we don't want to, like, resign ourselves to being content. We actually want to feel kind of bad and use that badness to improve our situation in a weird way. So here's the thing. What do y'all think is the primary emotion that is controlling this person's life? Pay attention to the question. What do y'all think is the primary emotion? So people are saying self-pity, resentment, fear, shame. So now I'm going to ask y'all a different question. Doubt, shame, discouragement, jealousy, fear. Okay, so I'm going to ask you two questions. What do you think is the primary emotion this person is feeling? And what do you think is the primary emotion that is controlling their life? And that may sound weird because aren't those two things the same? Absolutely not. Right? So a lot of people are saying hopelessness, despair, things like that. So let's understand this. We're feeling hopelessness, but what's actually controlling their life is fear. This is what I experience, but at the root of this is fear. Now let's understand this very simply. So when I'm afraid of something, which of these 3 steps is an antidote to fear? Right? So if I were to say ideas, misery, contentment. Right? It's kind of interesting. So this is where I want y'all to understand this. When I'm afraid of something, okay, we're going to figure this out. Let's say you're afraid of something happening. What is something that you can do mentally to make yourself feel better about that fear? What do you tell yourself? So if I'm afraid that you can avoid it, right? So if I'm afraid that like I'm gonna fail this test, what do I tell myself when I'm sitting down to take the test? Yeah, so some people are gonna say like, I couldn't have done it anyways. Perfect, Xanderon. Right? Oh, this is already going to fail. There's no way I can pass. Might as well just try because there's no way I can pass. So it's interesting because if you assume the worst case scenario, and if you really pay attention to your fears, what you'll find is assuming the worst case scenario is actually protective against the fear. Because the whole point of fear is that it's uncertain. It could happen and it may not happen. But if I accept the worst case scenario and I learn to survive that, then the worst of the damage is done. And the uncertainty is actually removed from the equation. Do y'all get that? So contentment and resignation is actually a coping mechanism to fear. Do y'all get that? Because if I resign myself to it, if I just assume, if I tell myself there's no way that this person will love me, they're definitely going to break up with me. They're definitely going to break up with me. You're definitely going to, I can tell. You want to be out of this relationship. I can tell. Now, let's look at that. Well, you're afraid that the person is going to break up with you. And how does your mind actually adapt to that? It moves into resignation. It assumes it as true. There's no way I'm going to get this job. It's impossible. I'm so underqualified. I'm afraid I won't get this job. And so what does your mind do to protect you from that disappointment? It makes you resigned. And then the interesting thing is if you're afraid that someone's going to break up with you, and you go talk to your friends about it, and they're like, no, you're like the best person in the world. Like, no one would ever break up with you. You're so beautiful. You're so amazing. Anyone would be lucky to be with you. How does that make you feel? Does that reassure you? Absolutely not. Makes you more miserable. So now we begin to see how this sequence is actually rooted in fear. That the reassurance doesn't reassure. Reassurance makes you feel more miserable, makes you feel more resigned. Because the mind sort of has this thing where, like, I can protect myself against the fear by being resigned. And this is not just humans that do this, right? So, like, you'll see this, like, in animals who give up as well. So, like, giving up is like a biologically conserved thing across species. There's no point in wasting my energy when the conclusion is fixed. Right? It's not just humans. Like, animals will give up too. So if you want to break out, and I know it sounds kind of weird, but it's like, I feel like I'm destined for mediocrity. What you've got to fix is the fear. The fear is at the root of all of this. You're afraid. Because here's, like, let me put it to you this way, and y'all tell me if you think this fits. Only the best get to make their dreams or passions a lucrative reality. I guess I have to resign myself to a life of mediocrity and, like, doing some kind of monotonous task and suffer like everyone else. I'm going to rephrase this for y'all, and you tell me if you think this fits. You're not destined for mediocrity. I think that this person is afraid that if they give it their all, if they actually pursue their passions, and if they don't take the safe route, if they don't take the monotonous route, 5 years of sweat and blood and tears, and they still won't be successful. 10 years, and they still won't be successful. They're terrified of taking the road less traveled and it ending them up, like, in the desert where, like, they're SOL. How does the mind protect you from that? It says, no, my friend, you are destined for mediocrity. Don't walk that road. It's an unsafe road. Learn to be content with a life of misery and join the rat race where things are safe. This is fear. It's all fear. So a couple of other things that we'll sort of end with. One is that, let's talk about destiny for a second. So destiny implies linearity, right? The whole point is that no matter what I do, I'm going to end up here. So, like, there's like a linearity to destiny. Does that sort of make sense? There's not, but this isn't what life is like, right? This is really what life is like. So I've got a choice. Do I want to major in engineering or design? Okay, I chose design. Do I want to work at a big firm or do I want to focus on my art for a year? Am I going to do an internship over here or a fellowship over here? Am I going to learn how to use this? Am I going to learn how to use Photoshop? Or am I going to spend some time painting? This is really what life is like. There's no destiny in life. I mean, there sort of is, but it's not like this. Because you have a lot of agency in life. And you can still end up here from here. And so in a sense, like you can still, make a straight chain, kind of like you did here. The key thing is, though, there's a lot of branches. There's a lot of choice. There's a lot of agency. And this is where, like, this person makes a couple of these assumptions, like, issue is in the real world, only the best get to make their dreams or passions a lucrative reality. Like, I don't know what this person is basing the statement on. I don't know where this idea comes from. And if you're a creative-minded person, like, just to give you all a simple example, I was working with someone a couple of years ago who was very creatively minded. And they also like to travel. And so they're like, I'm not really sure, like, what job is for me. Like, I really like art, like, I appreciate art, but my favorite thing to do is, like, go to different places and see, like, local art. But I don't want to, like, make these, like, African portraits and stuff from Cuba and things like that. I just really like looking at it. And I'm very creative. I'm really good at, like, decorating and things like that. And so, like, how can you turn that into a job? So they did something really interesting. They moved to a city in the United States where a lot of people were moving to from another part of the country. And generally speaking, these people are wealthy. And so what they sort of discovered is that wealthy people don't like to have mass-produced art in their home. But also, like, wealthy people can't necessarily afford, like, a Rembrandt. So they started an interior design service where they, like, would help people decorate their new homes. And their big thing is, I'm going to source this with unique art from all over the world. That's fair trade. So you will get a unique piece of artwork that no one else in the world has, and it'll come from every piece of artwork has a backstory. So they traveled for a while, they took a bunch of pictures, they even bought a few pieces, and they came back, and, like, I kid you not, in this city, I know someone else who moved to the city recently, all of the interior decorators had at least a 3 to 6 month wait list to even get an appointment. And this person is, like, very happy now. It's wild. Like, I don't know how sustainable that is. I don't know that y'all can go and do this. My point is that, like, if you pay attention to the world and you bring real value to it, chances are you offer what you have to give, there will be people who will want it. Right? So this is where someone in hybrid area says that can't happen for everyone. You are correct. And also, which part of your mind is generating that thought? So as I say that, as I say, hey, by the way, this is actually a possibility. If you say that can't happen for everyone, I'll completely agree with you. That's not the solution for everyone. But the resigned part of your mind is going to say things like that. Right? Because it's going to say, don't bother going down this route. Just be content with misery. And this is where I'd say it's not the best that make their dreams or passion a reality. It's the people who really try and are open-minded and are flexible with how they actualize what they're interested in. Because there's a big gap between I'm a creative person and I need to be an artist. Maybe you could be an interior decorator. Maybe you could do graphic design. Maybe you could make NFTs on GameStop's new NFT market. Who knows? Right? My point is that it's not about like, and when you start out, like all you see, if you want to end up over here, your first two choices are this. You may never be able to end up here, but I don't necessarily know that even if you make it over here, that you'll necessarily be happy with this. Because this we've seen in our community a lot where people are like, I did everything I was supposed to do and I'm not happy. I got an engineering degree and I find it spiritually unfulfilling. I was good at math, so I decided to do engineering. The whole point is like, if you want to be content in life, like you got to learn some amount of internal contentment, sure. But then recognize that like destiny in life is not that fixed. You have a lot of choices, and recognize that what life is like chess. It's not like a linear game. And so what you should do is every step of the way, move the piece that feels the best to you at the time. Because what happens is everyone who makes all the right moves in life usually ends up in the wrong place. And so if you want to end up in the right place, what you've really got to do is be very careful about making, in a sense, quote unquote, the wrong moves, right? Like, oh, I like math, so I'm going to major in, or I'm good at math, so I'm going to major in something that I'm good at as opposed to something that I care about. So it's challenging. We oftentimes feel like we're destined for mediocrity. And it's not like there's a lot about that thought process that feels right. The problem, though, is that even though the primary emotion that we feel is despair, and so we try to tackle despair and we're going to learn how to be content with ourselves. How do I learn how to be content with misery? And when I start focusing on being content instead of not being miserable, like when I stop actually, like when I resign myself to my circumstances, that's what actually becomes a self-fulfilling prophecy. So this really starts with understanding, like, what is it that you're afraid of? And once we let that fear, once we tackle that fear in some way, process that fear, even vocalize that fear. I'm not saying it's going to go away and you'll be fear-free. Because the antidote to that fear is ironically resignation. Because if you assume the worst and you can manage to survive that, you can even tell, right? So I need to learn how to survive the worst and then I'll be okay. So let me choose the worst thing. Let me actually move towards the worst thing. And all I have to do is survive a worst case scenario, and then everything above that becomes easier. It's so challenging because the way that our mind helps us cope with fear is actually through resignation. But the moment that you become resigned, that destiny actually becomes true. Okay, let's move on. I'm going to just rest my voice for a moment. Okay. Let's move on. Update. Dr. K, what do you do on days when you cannot seem to focus on the things that you need to do? When do you just consider the day a write-off? Why does this happen seemingly with no explanation? Hey all, I have to write this article for a website and cannot for the life of me seem to focus today. All I have to do is edit it and change a few minor things, but no matter how many times I sit down to do it, I just can't focus. I've done a number of things in an attempt to take my mind off it. Changed my surroundings, sat in different places, ran some errands, cleaned the bathroom, did the dishes, mopped the floor, went for a walk. Now it's late afternoon and I'm once again trying again, but still with no luck. Look, this person is unlucky, right? So I'm wondering, at what point do you consider the day a write-off? How do you stop from judging yourself harshly for not working on whatever you needed to? even though you gave it an honest try. Why are some days like this? It's a great post. Fantastic post. So sometimes you got to get some work done. I really got to get this work done. And you try to get the work done and you just can't seem to focus on it. You sit down to do the work needs to be done. And your mind is like, sorry, bro, not just going to do it today. Or sorry, girl, not going to do it today. I just can't focus. So then you're like, well, crap. Okay, I just can't focus today. So do I take an L? Do I just say to myself, okay, this day is lost. I'm screwed. Okay, I'm just not. It just ain't happening today because my mind ain't going to do it. Right? It's kind of weird. Then the other problem is that you really got to do the work. And you know that you sometimes can do the work. Sometimes when you sit down, your mind is willing to do the work. But today's an unlucky day. Because that's what happens, right? It's RNG. It's some days the mind is yeah, okay, I'll do it. Other days it's no matter what you can do, or whatever you need to do, your mind is yeah, it just ain't going to happen today. And so the other thing that happens is on those kinds of days, it's okay, I don't want to waste the day. So what am I going to do? I'm going to be productive today. Even if I can't do it, I'm going to try to change. I'm going to run some errands. I'm going to clean the bathroom, do the dishes, mop the floor, went for a walk. Right? I'm going to do all the right things. Now it's late afternoon. I'm trying again. No luck. Because that's what's supposed to work, right? I'm supposed to help if I clean things for a little bit, then my mind will focus. It's really confusing. Because our mind doesn't do what we want it to do. And then comes this whole thing about do I accept that today is a loss? Because then it's you get in this really tricky sort of situation where it's do you beat yourself up for not being able to focus? Or do you go down this new age, positive emotion, acceptance? Oh, I'm sorry, bro. You couldn't just work today. You did your best, but you did the best. It just didn't work out. You're unlucky. It's not your fault. Don't worry about it. Love yourself. Accept yourself. Don't beat yourself up because you couldn't write the article that you need to write. It's wait a second. Do I just accept this? Do I keep trying? Do I beat myself up? Do I accept? Is it toxic if I beat myself up and give myself a swift kick in the butt and make myself sit down and buckle down and work? Or do I accept that this is an L today and I'm not going to do anything? And do I practice self-love and self-compassion? And then tomorrow, what if it doesn't happen again? And do I self-love more? Do I need more of a hug? How much self-love and cleaning and other kinds of distracting crap that is productive, right? Because we don't want to waste the day. Because if we waste the day, then we'll beat ourselves up and we'll feel guilty. We don't want to do that. So what do you do? If you sit down and your mind doesn't want to do what you tell it to do, what do you do? Do you self-love? Do you hope for better luck tomorrow? Because that's what we end up doing, right? We just try again tomorrow and hope that things work out. So we're going to talk about this, and I'm going to teach y'all what to do with your mind. Because the thing is, the mind doesn't want to do the work. And when your mind doesn't want to do the work, what do you do about that? So let's understand a couple of basic things. Let's talk about human performance for a moment. So you've written an article before. You know how to write the article. And yet your individual performance at writing the article is highly variable. So we have this assumption that performance correlates with knowledge or expertise. So this is a conversation that I have with people that I work with in finance. So a couple of years ago, I was working for a distressed investing private equity fund. So this was a group of people who essentially take failing companies and try to figure out, okay, which of these failing companies are actually have the potential to be very successful if we change management or if we do things like that, and which of these companies are actually crap. Right? So they're basically the dumpster divers of finance, where sometimes there's really good stuff in there. that due to market forces or mismanagement or whatever, like, is crap. And it's really interesting, right? Because what these people are essentially doing is investing in failed businesses. So the dumpster divers of finance in a good way. And the cool thing is that, like, on a given day, like, if they make the right choice, they can make a ton of money. Because there's actually like a really good company out there that just got unlucky. But they really could provide a lot of value and things like that. And if you make the right choice, it's like you make a ton of money. So they were doing really well, actually. And so as we were talking about, it's like, how do you know which ones to invest in? So that you can talk about analytics and number crunching and all this kind of stuff. And like they use all those kinds of tools. But at the end of the day, it's kind of RNG. I mean, it's not truly RNG, but there's some things just align within you. And what I really found when I was working with these people is that they sort of like, it was like highly variable depending on how their brain is working that day. So if their brain was working really, really well, they would be able to see the pattern, right? They were able to see the forest instead of the trees because the analytics are all the trees. You can crunch the numbers. I do my diligence for all 10 of these companies, but then something about my brain and pattern recognition just clicks and I'm able to see it. So the issue became about not being more experienced or being more knowledgeable, but understanding how to achieve a certain state of mind and controlling the mind to get it to do what you want it to do. The other place that we see this is in esports. And not even esports, just playing video games. So theoretically, when I work with an esports professional, every game they play, they have more knowledge than the game before. Theoretically, every game they play, they should be getting better, right? Because you've played one additional game. But what we tend to find is that performance is wildly variable. So what determines whether you're going to play well that day or whether you're going to play poorly that day? You don't have to be a professional. You can play Dota, League of Legends, CSGO, Valorant, like whatever you want. Fortnite, PUBG, Vampire Survivors, whatever you want. And what you'll tend to find is that theoretically you should be getting better every day. But what we tend to see is people are hard stuck at their rank for like a decade. And on some days they play well, and on some days they play poorly. The problem is that they don't know how to cultivate the right kind of day. They don't know how to cultivate the right kind of mind. So what we're going to talk about is how to train your mind to focus. We're going to go to the heart of it, the crux of it. So we have a whole guide about ADHD and how to do stuff, where we talk about all these different complex factors. We talk about environment. We talk about the neuroscientific effects of cleaning your bathroom. We talk about things like prioritization and organization. And we talk about all sorts of like how your mind works, how to control distractibility in the mind. We cover a bunch of different stuff in the guide. And all that stuff is useful. But what we're going to tunnel down into today, right, because we don't have time to do 20 hours of teaching today, there's a lot of good stuff in there, but we're going to focus on the crux of it. So let's start with a little bit of neuroscience. So I have my mind. Mind doesn't want to focus. And then there's this other part of your mind. I need to focus. And there are times where like you kind of, you know that your mind is not doing what it's supposed to. So the first thing to kind of acknowledge is that there are like different parts of you. So you know that you need to focus, but your mind is like, I don't want to. So we're going to sort of say that there's a self. This is actually a part of the mind too, but I'm going to put it in the self column for now. So the first thing to understand is that like you can direct your mind, but sometimes the mind doesn't comply. Now, from a neuroscience perspective, the ability for this to win involves essentially frontal lobes. So frontal lobes are responsible for the things like impulse control. They're also responsible for things like delayed gratification. They're also responsible for things like directing our attention. Okay, so we want to basically strengthen the frontal lobes. But what I want y'all to just notice is that there are different parts of your mind that are kind of conflicting. And how do we make one win and the other lose? Because right now what's happening is this part of the mind is winning. Right now the way that the equation is like this. Right? So let's try to understand what our options are. So I've got work to do. Option number 1. Versus, and if I try to work, it's hard to focus. If I don't work, I'm going to be bored. Mind doesn't like being bored. So I still want to be productive. So even if I can't work, let me be productive with like cleaning. Right? Because then the day isn't a whole loss. That's good, right? And then some of us, maybe this doesn't apply to you, but I know it certainly applies to me, we'll do something that's dopaminergic. So we'll do something like a video game. So which of these does our mind hate the most? Which one does it want to avoid at all costs? Absolutely right. So if we're going to rank these, what does it want to do the most? It wants to do this first, this second, this third, and this fourth. The problem is that your mind knows that you can't tolerate this. So your mind is playing a waiting game with you, where all I have to do is like, I know that this person isn't going to accept boredom. So instead, what the person is going to do is they're going to move towards productivity, right? Even if they stop me from doing the dopaminergic crap for a little while, it's just the waiting game. I know I'm going to win this. So like, here's the options. If I force this person to be bored, if I don't focus on the work and I let the mind be distracted, they're going to become bored. And once they become bored, they can't tolerate being bored. All I have to do is distract them from the work. They're going to become bored. And then they're going to be like, oh my God, I'm wasting time. They're going to be productive for a while. They'll work for 2 to 4 hours, right? Because we've got errands and stuff. And then what are they going to do? Then it's the afternoon. Oh no, the day's a loss. Oh, I'm trying again. No luck. Okay, well, might as well just play video games and might as well just like take the day off. So your mind is playing a game of chicken with you. And its secret weapon is that it knows that boredom will control you. And the more that you use your cell phone, the more that you take a dump and browse Reddit at the same time, the more dopaminergic stuff that you do, the more intolerant to boredom you become. Right? Because when I grew up, we used to still get bored. We used to do this thing, I don't know if you guys have ever done this before, called playing outside. And people may ask me, they're like, what did you play outside? We didn't play something, we just played outside. Every day after school, between like 3 and 6 o'clock, we would just go and play things. Sometimes it would involve balls and bats and basketballs, but sometimes it didn't. We personally played this game called multi-type. We made up our own game called multi-type, and we would play multi-type, and it was like relatively fun, but the rules were kind of rigged. Right? So this is the key thing. If you want your mind to focus on a particular day, there's one simple thing that you can do. Understand this, but understand that all of the mind's power over you revolves around boredom. So when my dad was in medical school, he had a rule for himself that if he didn't feel like studying, and he taught me this rule, by the way, if he didn't feel like studying, he wouldn't study. He was allowed to sleep as much as he wanted to. He was allowed to sit there and do nothing as much as he wanted to. But those were his only 2 options besides studying. That's it. Nothing else. This was off the table. This was off the table. He's got two choices: work, boredom, or in his case, sleep. That's it. If your mind doesn't want to work, that's okay. We don't need to work. If you can't focus, no big deal. We're just going to sit here and do nothing for the next 8 hours. And whenever you're ready to work, we can do that. But if you don't want to work, no big deal. We can take a nap. If you're feeling tired, oh, you're tired, let's go lay down. It works incredibly well. Incredibly well. I did it myself. I didn't feel like working. I wake up in the morning, make myself some breakfast. It's time to work. I don't feel like working. Okay, you can go lay down. But what am I supposed to do when I lay? You can sleep if you're tired. Like if you're tired, like obviously you need energy. Then when I'm done sleeping, I get up, I sit down at my desk, and I stare at the friggin' page. And if I don't want to stare at the page, I don't have to stare at the page. I can close it. And I'm just going to sit there. That's it. Eventually what will happen is your mind will focus on work. As long as the mind knows that there's no alternative, because here's the thing, you can actually tolerate boredom better than your mind can. Your mind is going to be completely SOL if it's bored. It's the one that's suffering, not you. And that's where we go back to the sense of self. The self can tolerate boredom fine. Like, what is meditation? It's sitting there doing nothing with a no mind state. Like, isn't that boring? No, like, it's actually wonderful. We love that if you really sit down and do it. So if you want to learn how to focus, what you've got to do is like practice focusing. And the way that you practice focusing is you keep doing it until your mind starts listening. And if you get bored, you get bored. We're not going to come up with fake stuff to do. We're not going to come up with dopaminergic stuff to do. And you may say, but what about the stuff that I do need to run errands? So this is where it's really important. Are you deciding to be productive because you feel bored and you don't want to waste the day? Or did you set out with a schedule to do this stuff on this day? Right? There's a big difference. Is your productivity an antidote to boredom, or is it stuff that you actually need to get done? Someone earlier was asking, what about doing things like working out? So I have to like cook, I'm going to shower, I'm going to exercise. So that's fine. Like I can even run errands for an hour or two, but that's going to not be an antidote to boredom. This is really important to understand. Because the moment I make it an antidote to boredom, what I'm actually doing is giving in to my mind. I'm not actually controlling it, it's controlling me. It's just tricking me with it's just sweetening the poison, right? It's just like poison without the guilt, but it's still giving into the distraction of the mind. So what should you do if your mind doesn't listen to you? You're going to sit there and you're going to be bored until it's ready to work. And when it's ready to work, we can work. And then something magical will happen. Once your mind understands that you're not screwing around, and you will literally have it sit there for 12 hours and do absolutely nothing, it'll start working. It'll start working. You will have taught it how to do what you tell it to do. You'll sit down and you'll say, we're going to read this thing. Now, there's also like a couple of other tips here about intentionality. So if you're struggling to do your work, I would sit with the self. We'll talk about this this is almost like a meditation of sorts, right? So I want you to start by noticing your mind. I don't feel like working. And then what I want you to do is sit down and prepare yourself for work and see what I don't feel really is. Is this a feeling? Or is what's happening, I'm looking at the page, but my thoughts are wandering. And then like this is going to create another feeling, like frustration. I'm wasting my time, whatever. And then what's going to happen is as we're feeling frustrated and wasting our time, let me go clean. And as I go clean, what am I actually giving into? Who's in control here? My frustration. I cannot tolerate frustration. And as I can't tolerate frustration, I lose control of my life. Because think about that. Two people, one can tolerate frustration, one can't. Who's screwed in life and who's going to do well? It ain't difficult. So sit there and look at yourself. Close your eyes the next time you need to work. And look at what does I don't feel like working actually mean? And then what I want you to do as the self, let's say you have to write a paper. Can I write a single sentence? Well, I don't know which sentence to write. That's what the mind rebels with. So notice that as well. You want to notice all these thoughts as they come up. I don't know what to write. Okay. What do you need to learn so that you can write the first sentence? How do we get to the first sentence? What's getting in the way of the first sentence? Right? Is it research? Is it just putting something out there? Is it something? What is it that's getting in the way? Now, here you have to be a little bit careful, because if you're not careful, you'll end up somewhere over here. Because they'll be like, oh, we need to do more research. 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 Because oftentimes, I don't know what to write is actually, I'm not confident. And then you're looking for some kind of research, so that you start to feel confident and then you know what to write. Sometimes what you have to do as the self is tell it, well, too bad. I understand that you're not confident. We're going to write anyway. We're just going to write something crappy. But you're going to sit there until you start writing words on a page. And if it's wrong, we can fix it later. Because here's the thing that I want you all to understand. As you do this process, as you sit and really pay attention to your mind, what you'll notice is that your mind is incredibly slippery. And it'll come up with whatever excuse it can to keep you from doing what it doesn't want to do. And your mind knows it's a waiting game. Because if it can stall, you'll become frustrated. You'll give up on the day. You'll be able to take a loss. You'll practice some self-forgiveness. Oh, no, it's okay. It's okay, baby. It's okay, beta. Oh, it's okay. You tried so hard today. You tried for 4 hours to write. So now that you tried so hard and you failed, now we can go play League of Legends for the next 10 hours. It'll come up with all kinds of things. Oh, we're not ready to start. We need to do more research. Just notice what you need to do in this, like a meditation technique. As you sit and you close your eyes, notice how it will twist and turn and give you as much stuff as it can. But there's always going to be one conclusion. Don't write. All roads lead to one place. Don't write. And once you see that, you'll begin to realize it's all BS. It's all BS. And then you sit down and you start writing. And if your brain is like, I'm not ready yet, okay, then we're going to sit here until you are. We're not going to be, but we're going to waste the whole day. Let's do it. This needs to get done. No, but we can be so much more productive if we do this other stuff. That actually doesn't fix the problem. This article needs to be written. So you have to be able to, the whole point is that the mind tricks you. People will waste their entire lives because of the trickery of the mind. The mind tells you not today, not today, not now, not now. We'll do it tomorrow. Here are all the 1,000 reasons. You're not ready yet. You could fail. It may not be good enough. Not today, not today. A day goes by. I've been there. I literally saw it happen in my life year after year. It started around that age. I was 15. Straight up almost failed out of college, was on academic probation my freshman year, and still my mind was like, not today, not today. Year went by, a second year went by, a third year went by. It could play this game all day long. And why? Because it knew that it was in a game of chicken with me. And I would give in because I was not willing to waste a whole day. And in that, I almost wasted my entire life. If I'm not going to get any work done, I might as well have fun. I was not willing to waste a day. And when you're willing to waste a day, then your mind will start to listen. You're like, we're going to sit here until we do it. But what about this? That's okay. You're going to waste the day. Okay. I'll waste as many days as I need to get this done. And once your mind understands that, it's going to get into line. Does that make sense? Holding yourself hostage, you're not holding yourself hostage. Good point, Dinitz. You're holding your mind hostage. Here's the tricky thing. In your mind, there's a set of bars. There's a cell. One of y'all is on the inside, one of y'all is on the outside. The self is on the inside or the mind is on the inside. You get to decide. Right now, it's holding you hostage. Yoshio is asking a good question. Why do you consider the mind and the self two different entities? Because of experience. So if you close your eyes, you will be able to observe the actions of the mind. So do I consider myself different from my hand? Is this hand me? Well, sort of. I'm me, even if something happened to my hand, let's say there was a terrible accident and I lost my hand, that would be awful. But I wouldn't stop being me. The mind is a part of your being, but it's just a part. And as we start to peel back the layers of the self, what we end up with is there's a pure self in there that is actually not the mind at all. And once you meditate, you'll be able to realize this. Because once you experience existence without mental activity, then you'll understand what the self truly is. Is the self your consciousness, basically? Yes. That's one way to put it. Is the mind a separate conception of the brain? No. Well, a separate conception of the brain? The mind is not the brain. Right? So the brain is a physical organ. The mind is not a physical organ. So ADHD is not real? No, ADHD is definitely real. Why would you conclude that ADHD is not real from this? We're not saying the mind is false. We're just saying it's not the self. We're not saying that your brain doesn't exist. Ninja First Class is asking, if you lost your brain, are you you? That's a fantastic question. I don't know the answer. Right? So that's... I still think you will be you. So this is where I haven't had... Let me think about this. Yeah, I think you would still be you without your brain. There are absolutely severe brain injuries where people will change personalities drastically. So we're not saying that the mind is completely independent of the brain, but they are different. Right? So we know, for example, that just like in what we just explained today, we talked about the correlation, the neuroscientific correlation between some of these mental functions and directing the mind versus the self in the frontal lobes. We can even map some of those mental functions to particular parts of the brain. Now, a biological reductionist will posit that all of the mind is a manifestation of the brain. I think that that's sort of true, but also incomplete. Because I think that in the way that there's like matter and energy, right, the experience of consciousness is different from physical form. So like the experience of taste or pleasure may be mapped onto the brain, but there's a difference between a physical object and an experience. From like a, what's it called? I'm not good at philosophy, but a quali? There's like some philosophical term for this. Qualia, right? So the qualia of substance and the qualia of experience, to me, feel fundamentally different. So I agree with that philosophical branch. And that too is based on kind of experience. There's like a different stuff to like, you know, touching something and like experiencing something. Anyway, great conversation. I mean, like some of this stuff gets into like the philosophy, spirituality, call it whatever you want to. At the end of the day, though, what we're talking about is how to get your mind to focus. And if you guys want a lot of different methods, there are all kinds of stuff that does help. So cleaning your room, for example, does help because of top-down and bottom-up processing in the brain. There's a bunch of different stuff. If you guys are interested in that, that's the guide that we're working on. So we were really struggling for a while to figure out, okay, what should we do next? And what I realized is what our community needs more than anything else is like, how do you do stuff? Like, how do I do stuff? It's such a simple question, but it's something that we struggle with so much. So we made Dr. K's Guide to ADHD and doing stuff. It's like, how does stuff get done? Like, what are the different components, neuroscience, psychology, spirituality, that involve doing stuff? So today we sort of got a how can I say this? A slice of the process of doing stuff on a very fundamental level of like, how does the mind work? And like, why does it trick you? And like, what techniques does it use to trick you? But there's a lot of other stuff too. There is neuroscience. There's even clinical medicine, right? When it relates to ADHD. And then there's sort of like this yogic perspective on like, how do you control your attention? Why did we combine ADHD with doing stuff? Because ultimately doing stuff is about controlling your attention. So when I sit down and I try to study and I can't, what does that technically mean when I can't study? What that means is that my attention is not going where I tell it to go. I sit down and I try to study and my attention goes elsewhere. I can't stop playing video games. Let's think about that. Why can't you stop playing video games? Because my attention is constantly on them. I think about them. And the only time I feel at peace is when my attention is stuck in the video game. So it all comes down to attention. And this is where people will say weak willpower. Willpower is a piece of it, but I think willpower is actually it's an unsophisticated term. So this is something that we go into. So there's all kinds of neuroscientific calculations that are going on. That when those calculations are not proceeding properly, it looks like quote unquote weak willpower. The interesting thing is that you can actually manipulate those calculations to create more motivation, which looks like willpower. But the interesting thing is it's not that the person has increased their willpower. They've actually increased their motivation. And remember, when you're motivated, you don't need willpower. Willpower is what you use to overcome motivation. And so you may be asking, what do you mean there's some calculation? So I'll give you just a really simple thing. So I have this video on something called the action success calculation, where your brain constantly, and there are studies on this, so this is something we understand very well, constantly decides what to do, and it integrates all kinds of information. One of the key parts of that action success calculation, one of the key parts of figuring out whether to motivate you or not is actually the success likelihood of a task. So if I think I can succeed at something, I'm going to be more motivated to do it. If I don't think I can succeed, I'm going to be less motivated. Who here thinks it would be cool to own a yacht? Who here is motivated to build a yacht? Well, if you want a yacht, why don't you build one? Because I don't think I would be successful, right? There's like zero motivation for building yachts, even though we all want yachts. So that's like an extreme example. That's so extreme that it almost doesn't make sense. But basically, like, even if you look at like studies of people who will ask other people out, what you tend to find is that you're more likely to ask someone out if you think they're within your league. What does that mean? That means that the action success calculation is telling you, hey, go ahead and ask this person out because we have a decent chance of being successful. Now, how do you manipulate that calculation to create motivation? Very simple. Self-worth is a huge part of that calculation. So this is why we see this in coaching, where people will come into coaching and they'll say, I'm not motivated. And what we'll do is we'll work on their ahamkar, their ego, their sense of self. We'll work on their confidence. And then 7 weeks later, they're doing stuff. They're like, yeah, I did it. And then the coach is actually really confused. They're like, they don't say it to their client, but then they'll come into case review and they'll talk to me about it. And they'll be like, I'm really confused. I thought this person, we've been talking about this for 7 weeks. They haven't done anything for 7 weeks. And then suddenly they wake up one day and they're like doing stuff. And it all goes down to these different kinds of like neuroscientific techniques. So when someone becomes more confident in themselves, it alters their perception of the chance of success. As it alters your perception of your chance of success, in our dating example, this becomes very simple. If I have low self-worth, I think I'm in a low league. I'm in the amateur league. And once I work on my self-worth, I realize, oh, I'm confident. I'm actually like a valuable human being who can offer something in a relationship. And then suddenly I'm able to actually ask out people that I'm attracted to, instead of asking out people that I think I can end up with, who are willing to accept me. And it revolutionizes the way that you live your life. And it all comes down to neuroscience. There are literally basic science studies on schizophrenia and motivation that once you look at all of these like end psychological studies about dating and relationship perception, and then you combine them with like brain scans of people with schizophrenia, you can map out how the system works. Once you map out everything from neuroscience to psychology, you also get an understanding of like how the equation is written. And once you understand how the equation is written, then you can start to alter certain variables, and then you can almost like calculate motivation. How do you increase self-worth? Great question. So a lot of that, at least in a coaching context, comes from asking people about where they got their perceptions of self-worth, right? So this is the tricky thing, is that your perception of your self-worth comes from somewhere. It tends to come from experiences. So you have experience, you generalize that experience, and then your brain has this part called the default mode network, which takes a lot of generalizations and then forms it into an identity. Why does it take general experiences and form it into an identity? Because that is efficient. So if, for example, I learn that I'm an introvert and I form that conclusion, that then makes a lot of my calculations down the road very easy. So if I'm an introvert, that affects, do I want this job or not? Well, how many people are involved? Do I want to go to this party or not? How many people are going to be there? So once we develop an identity of self, it makes living life easier because we have like an organizing principle of like, because otherwise like there's no way to, decide. And so increasing self-worth has to do with, first of all, understanding how you developed a sense of self-worth that is what it is, which is, let's assume, low. And then what we have to do is go through those experiences and reinterpret them. So I'll give you all one from my life, for example. So I grew up thinking I wasn't good at sports. Just not an athletic person. And as I tried more and more stuff, what I really realized is I like doing outdoor stuff, and outdoor stuff is not competitive. And so I thought to myself, oh, like I just like the outdoors. Like it's not that I used to think I was like not into physical stuff at all. Then what I realized is I like outdoor stuff, I don't like sports. But as I went through and started interpreting that stuff and doing my own work, what I realized was the reason I didn't like sports was because I was bad at sports. And the reason I was bad at sports is because I was 1 year younger than everyone else. So I was a 5-year-old learning basketball against 6-year-olds. In a race, I was a 5-year-old and other kids were 6. Some of them were 7. And a 7-year-old will destroy a 5-year-old in a race. And when every day I went to gym class and I got owned time and time and time and time and time again, I realized that I'm bad at sports. I'm not good physically. I developed a sense of identity. This is something I discovered. My first instance of this was actually Malcolm Gladwell wrote a book. I forget, maybe it's Outliers, where he analyzed hockey players and realized that professional hockey players are not randomly distributed in terms of their birthdays. And the conclusion that Gladwell came to is that some kids, like when they were 5 and 6, were physically larger and basically 1 year older than other kids. And if you're physically larger, the coach looks at you, you seem more talented, and then you get more attention. Because that absolutely happened to me when there are 30 kids in the class and then there are, let's say, 8 kids on the basketball court at a time and they play for 20 minutes. Who do you think was the kid that was left on the bench the whole class? It was me. Because it wasn't worth it. And I was happy not being on the court. So this develops a sense of identity. How do you fix that? You go back and you reinterpret it. The challenge is this is really hard to do on your own. This is why working with someone is very effective, because they're going to see through your BS, whereas you can't. Case in point, like if we look at this, right, this case, this seems, let's go back to this one. This seems very logical to this person, even though you can read this and you can say, this statement doesn't actually make sense. This is not true. Or it makes sense, this just isn't true. So the problem with self-worth work is that it's very hard to do on your own, at least in a focused way. So you can absolutely improve your self-worth over time, like over the course of years. But if you want to improve your self-worth over the course of, let's say, 3 months, it's really hard to do. Not saying it isn't possible. Like, for example, when I was at the ashram originally in India at the age of 21, I would go for a walk 1 hour a day with my guru, and we would talk. And it was something like psychotherapy, but really it was closer to coaching. It was like we were talking about me, and he was asking me questions and we were learning about me and stuff like that. So it wasn't a therapist. I learned a lot about myself, but it required his external perspective to help me gain insight into myself. And my self-worth grew a lot over those 3 months. Anyway, so one thing that we're going to do, so we're going to raid, but before we raid, actually, let me make sure that I'm okay on timing. So we've got Ask a Coach on Motivation is live right now. So if y'all want to, you can actually go straight to that. We're going to go ahead and do a raid anyway, but if y'all are really interested in this stuff and you're curious about it, I would just go hop on Discord right now. And just check it out for yourself. So if y'all are curious about I know the coach, I think it's Pax who's on today. And I would ask Pax, if y'all are curious about self-worth, for example, go in there and ask them, Pax, when you work with someone, do y'all work on self-worth? And what does that look like? Do you work on motivation? And what does that look like? I have this kind of problem. What do you think about that? Go ask Pax. And so it's one thing for me to be on stream and say, this is how it works. It's completely different for y'all to go and talk to Pax yourselves. I think it's Pax. May not be. So definitely check that out if that's what y'all are interested in. I think that's a great choice for a quote-unquote almost raid. But we're going to go ahead and raid for people who are interested in listening to something on Twitch. And who do y'all want to raid? What do y'all think? Potent. Okay, Potent is playing League of Legends, so we'll raid Potent. Because apparently I saw this tweet that 75% of our community plays LOL, and 25% of our community plays Dota. And while that makes me sad deep in my heart, it also makes me realize that maybe I'm missing something. And so maybe what I need to do is actually play some more League of Legends and give it another shot. So we may do that at some point. Take care. Have a good day, everybody.